The Ministry of Health is proposing to offer a second shot of the Johnson & Johnson J&J vaccine as booster shots continue to make headway in becoming necessary. This was revealed by Minister of Health Dr. Frank Anthony during today's COVID-19 update. This particular vaccine was initially offered as a single shot, but to boost its efficacy, scientists around the world have been vouching for a second shot to be administered. Several international agencies have already recommended the second jab. The minister said that Guyana will closely follow the recommendations of these highly credible and authoritative organizations.
We in Guyana, we would certainly review the technical information that is emerging from the CDC and see whether or not we would need to change our recommendations. But so far, the WHO continues to recommend the J&J vaccine and would have updated it to say that instead of it being a single dose, that countries who have offered J&J should consider offering a second dose 2 months after your first dose.
Further, in response to claims of frequent blood clots emanating from the inoculation of the J&J vaccine, Dr. Anthony noted that these occurrences are extremely rare and should not be a cause for concern.
With J&J, they notice a very rare side effect that can happen. And that is, for some persons, they can get thrombosis, meaning they can have some blood clots. But it's an extremely rare event. There have been more than 40 million doses of J&J that has been administered around the world, and they have seen a few cases of this.
Meanwhile, in light of the Omicron variant that is rapidly spreading across the world and amidst allegations that vaccination is no longer effective against this new variant, Minister Anthony reassured that vaccination is still the most viable option in fighting the virus.
Almost all the vaccines are built around presenting to our immune system that spike protein so that it would elicit an immune response from our bodies without giving us the disease. But if the spike protein has mutated so much, having 32 mutations, then when Omicron comes with all these mutations, initially the body might have a difficulty in recognizing it. That is what scientists fear. They call that immune escape, because the body does not readily recognize the changes that are there. And because of that, a lot of people can get infected very quickly. If you have been vaccinated, more than likely you can get infected or reinfected even if you had the infection, but you would more than likely get a milder form of COVID-19, which means that we might not see so much hospitalization nor so much deaths. Over the last 24 hours, we would have recorded 21 new cases, and right now across the country we have 818 active cases. In all the regions we have active cases, but right now in Region 4 there are about 390 active cases across the region. That is followed by Region 6 with 189 cases and Region 3 with 95 cases. So these are predominantly the areas where we have active cases. As of yesterday, we've had 38 persons in hospital. Of the 38, 31 of them are at the Ocean View Hospital, with 11 persons in the ICU. Of the 38 that are in hospital, we have 26 persons who require oxygen, so they have a more severe form of COVID. In terms of adults, that's 18 years and over, we've had 408,838 persons receiving their first dose of a COVID-19 vaccine. That has taken us up to about 79.7% of our adult population getting vaccinated. In terms of second dose, we've had 290,688 persons receiving a second dose of a COVID-19 vaccine. So we are now at approximately 56.7% of our adult population being fully vaccinated. And we've also been administering vaccines to persons 12 years and older, so 12 to 17, that age group. And we have completed 30,028 doses for first dose for this age cohort, and 21,309 as second dose. So that would be approximately 41.2% first dose for this age cohort 12 to 17, and 29.2% as second dose for the 12 to 17 age cohort. We have also, as you know, about 3 weeks ago started to do booster doses, and as of yesterday we would have completed 9,126 booster doses. 9,156 booster doses.
Minister Anthony is urging persons once again to remain vigilant and to continue to follow all COVID-19 protocols.
I know it's Christmas time. I know a lot of people want to socialize. I know a lot of people have been going out in crowded areas. And again, I would urge those people to really think about their personal behavior. Is it absolutely necessary to go to these crowded shops? Is it absolutely necessary to go to crowded events? And if it's not, then you have to make a conscious decision whether you want to be in an environment where potentially you can get exposed to COVID, and if so, you can get sick, or you can stay away and prevent that from happening. So I think people really ought to give serious considerations to what they're doing, to their behavior, and if they can adopt the right attitude, then certainly we'll continue to see a decline in cases and in the amount of people requiring hospitalization.
This has been our COVID-19 update for today, December 20, 2021. For more information, please visit our website at dpi.gov.gy or any of our social media platforms.